Now I'm gonna wait.
Okay, let's have a class. Unfortunately, this system doesn't work because this screen is completely like, they said it is powering up. And they asked me to call some classroom technology. I'll just skip that. This is gonna maybe come in 20 minutes. So I'll just go ahead to teach. You have these slides. I'll tell you what we're gonna talk, which slides it is. Okay, I know what's on there. Anyway, most of the time, this section I will draw on the blackboard. So we'll talk. So we finished talking about. So you can take a notes and also video recorded it. This is gonna be a while. If it showed up, I'll just pick it up. So what we talk about is DTAP. Wait a second. Let me just in this one. We talk about DTAP. This is diphtheria. I'll just turn this off because that one doesn't work. Shut down. Okay, this is diphtheria we talk about. And we mentioned what is P. Babesia pertussis. So we just briefly go over it. This pathogen is called whooping cough. Okay, and we say that this is a very productive cough and with respiratory gasp. And we mentioned how we're going to diagnose this. When we diagnose this, we're going to using a so-called transport media. And this transport media called Reagan lower transport media. And remember, this is the one we're using via ferro transport media. And this is going to go to reference lab. And in the reference lab, we also do a quick test, which is using the PCR methods, get from the Dacron swab. Okay, so this is something we just briefly mentioned, what we left last time. And then we're going to talk about today's material. Today what we're going to talk is Streptococcus and Staphylococcus. So if you look at your slides continually, I don't know how to shut this one off, because this is like a dead there. So first of all, the pathogen is Streptococcus Ammonium. Okay, this is the one we first going to talk. We mentioned this a couple of times already. First of all, this is gram-positive coccell, and we know what it looks like. Coccell looks like a coccell in the center, like lancet shape, and it's packaged with very heavy capsule. So gram-positive diprococcell, lancet shape. This is the first characteristics of Streptococcus ammonium. Okay, Streptococcus Ammonium, the second thing. We also want to mention, we had a slides we talk about on blood agar. This is alpha hemolytic. If you still remember, alpha hemolytic, which means incomplete hemolysis of blood cell, and it is a dark green color. Okay? Number 3, we want to mention, what are the symptoms? This one will cause 80% cap in the United States. What is cap means? Community acquired ammonia. So that's, it causes 80% community acquired ammonia. Now what are the symptoms? You have a fever, cough, and chest pain. Okay, now be careful. When we talk about ammonia, this means adult people. Adults. Okay, around 40-year-old. If you still remember, for Streptococcus ammonium, if the people more than 40-year-old, which disease it will cause? We talk about is meningitis. Okay, now is the key thing. How about young people? How about people younger than 5 years old, the kids? It will cause ammonia, yes, but they could cause other things. Number 1, it could be happen is otitis. What is otitis looks like? Buzzing, raining, and ear pain. That happens. Inflammation of the ear. Okay. The second thing will happen is more severe is bacteria in blood. So first of all, you need to know our blood should be sterilized, should not have any bacteria. If the bacteria in the blood, that is not good. Streptococcus ammonium sometimes will cause, and which means it is very invasive. Now, what terminology used to describe the bacteria in blood? Number 1, septicemia. Number 2, bacteremia. Now, what's the difference between that? Septicemia, the bacteria localized and survive there. For bacteremia, the bacteria will not only survive, but also will grow in there, which means will cultivate in there. That's the difference. Okay, so be careful for young kids. This pathogen has these 2 new characteristics. Now, of course, this will cause ammonia. Once this causes ammonia, people have to use antibiotics. That's something we will mention later about antibiotics in more detail. Now we want to mention something else. If you look at your slides, we mentioned the blood agar. Remember we have these, something like this on your slides, and we're going to talk. So the story is, we have the Streptococcus ammonium. It goes upper respiratory tract. Then we get a sputum sample. Then we go do isolation. But I tell you one thing, since it's going through your oral cavity, it's not going to only have Streptococcus ammonium. There is a lot of other Streptococcus. That is called Viridium Streptococcus. This means a group of Streptococcus. You can easily understand it like a various type of Streptococcus. Now, one example, that could be Streptococcus mitis, bovis, and mutans. Especially like mutants, that could form the plague OUTs. So once you're going through, get a sample, you will see clinical sample. There's a lot of Streptococcus. Then how you know it is Streptococcus ammonium? How do you know it's Viridium Streptococcus? Sometimes you could do a gram stain, find a Diplococcus cell. Sometimes it's difficult to do. So we using a method called P-disc. So how we do it? On the blood agar, we put 2 discs in. These discs containing one of the antibiotics is called optecan. Once you put optecan there, then you grow bacteria on the side. What happened is Streptococcus ammonium will be susceptible, or we say sensitive, to the optecan. Therefore, it's showing you transparent zone. So which means this bacteria will be killed by optecan. And the Viridium Streptococcus, it is survived there. So you will see a very crowded area surrounded the P-disc. Okay? So this is, we will say, it is resistant. So that's the way in the clinical area to differentiate Streptococcus ammonium and the Viridium Streptococcus. Now there is some other questions. People say, why you have to use P-disc? Because you have a blood agar. You can see alpha, beta, gamma hemolytic. Why you have to use this? The reason is Viridium Streptococcus and Streptococcus ammonium both are alpha hemolytic. So you're not going to see the difference on the blood agar without the P-disc. That's why you have to use it. And by the way, Viridium Streptococcus also could cause a problem. Although it's widely existing normal in our oral cavity, it could cause so-called endocarditis. This is kind of like an inflammation of heart valves. So a good example will be if you have a 60, 70-year-old grandma and go to take out of the wisdom teeth. If the clinical area, they failed to do the oral cavity hygiene, she maybe died a couple of days later, like 1 week. There's a real story about that. Why? Because Viridium Streptococcus widely existing in the oral cavity. If you don't do a good dental hygiene after taking out of wisdom teeth, it could be penetrated, go to the heart area and cause inflammation of the heart valve, which is called endocarditis. And the lady could be dying. So that's really have the risk there, okay? So that's why this information is important. Regarding the difference between Streptococcus ammonium and Viridium Streptococcus, both of them are alpha hemolytic, and we use P-disc as a component. It's called optecan to differentiate that. So this is the first thing we want to mention. Then on your slides, it talk about how we gonna be to do the prevention of Streptococcus Ammonium. We mentioned very briefly how we do that. We had a Pvc vaccine. Now, where is that vaccine comes from? The vaccine comes from the capsule of the Streptococcus Ammonium. Okay, so remember this is a Streptococcus, and this is a heavy capsule. When you see this heavy capsule, you could take it out to make a manufacturing a vaccine. This is called the Pcb Vaccine for Streptococcus Ammonium. Okay, so this is mentioned on the slides. Now, we mentioned about Streptococcus Ammonium is responsible for 80% of the ammonia in the United States. Then the second pathogen, we just want to mention very briefly. We have a slide corresponding to this called Pvc Ammonium. Okay, Pvc Ammonium, I will say, this is only responsible for 2% of the ammonia in the United States. Although the genome name is ammonium, it's a little bit different. This pathogen most responsible is for urinary tract infection, UTI, and little bit infant diarrhea. More for the UTI. And this bacteria is gram-negative, large shape, and lactose fermentation positive. Also has a heavy capsule. So we want to talk about this. You look at your slides. You look at your slides, you see a McConkey agar. On the McConkey agar, you see a single colony there. On the McConkey agar, it is pink colony. Because lactose fermentation positive. Then you also see a blood agar. How you see it? Did you see all those colony a very heavy smear like a cheese? We call it a cheese-like colony. Because of the heavy capsule. And these type of the colony, we call it mucoid colony. Now, these type of the colony of the blood agar or McConkey agar show a very heavy smear, like a cheese called a mucoid colony. Now, what's going to happen for the sputum? If the people have Pvc Ammonium, they have a sputum sample comes up, what's it going to be looks like? The sputum sample will be very purple and looks like currant jelly. Currant jelly, you didn't have them too much. You didn't get very easy in the United States. This is why you can get very easy in the European countries. You can think about it like a grape jelly. It's like kind of like a grape jelly. You have a breakfast, you have a hamburger, put the cheese, put a ham, and sometimes you put some grape jelly there. This is looks like. So the people, if they have Pvc Ammonium, their sputum sample is very heavy currant jelly because of the capsule. And if you inoculate it, strip it onto McConkey agar, it is pink colony, lactose fermentation positive, very heavy smear. It's called a mucoid colony. Okay, so that's something for Klebsiella ammonium. We just want to barely mention this, not going to mention too much. So that's why I had a one slide to talk about this. Okay, now we're going to talk about is Streptococcus Pyogenes. We can move forward. We're going to talk about it. And I will remove this because I'm going to using this area to explain something. Streptococcus Pyogenes. Once you look at this name, you see PYO, which means pus. You see GENES, which means genetic. Okay? Now, Streptococcus Pyogenes, everybody knows, will cause strep throat. Now, a long time ago, lots of people sent me a short email, said I'm not going to be in your lab because when I woke up and I find a strep throat. These days it's all COVID-19, it's not talk about this anymore. Okay. Strep throat. That's everybody knows. Even you didn't take in general microbiology, you know. And I tell you one thing, this is beta hemolytic. We will do a conclusion of everything at the end of this class, okay? Beta hemolytic. What that means, which means transparent zone of blood atom. This is we talked about already. That's why I have that slide there. You see it very clear. And lots of you will see. This is called Group A, Streptococcus. Okay, here we want to talk about this. What is Group A? Lots of the textbooks, they just say it's GBS, GAS. They don't explain that too much. We want to write here. Okay, this is called Rebecca Lansfield group. So Rebecca Lansfield, this is a name. This is America clinical, I will say, microbiologist. Back in around the 1930s, her group did some of the research. How they get it? They get of the different streptococcus, the antigen from rabbits. Now, of course, when they go there, coming from the blood serum, they get some of the antibody also. Then they also have a streptococcus extract solution. And this should be the antigen. And this should be the antibody. And they do an antigen-antibody reaction to see whether there is a precipitation happens. If there is a precipitation happens, they could be doing serological typing. Serological typing of Streptococcus. Okay, based on these. Therefore, it comes out with different groups. Group A is Streptococcus Pyogenes. Group B is Streptococcus agalactiae. Group D is Enterococcus. Now, you're going to ask me, how about the Streptococcus ammonium we just mentioned? For Streptococcus ammonium is not belonging to any of the group. Because remember, this is coming from a cell wall structure. This is actually coming from a cell wall. And they basically rely on M protein. If you look at your slides, you will see Streptococcus Pyogenes have a very obvious integral or internal protein, which is marked M protein. Streptococcus ammonium, there is no M protein. So, it's not going to work for these antibody-antigen reactions. Therefore, this one did not characterize to any of the group. Okay? So this is something, on the other side, I'm explaining to you what is the group A strep. We will mention group B strep real quick. That is Rebecca Lunsford group. So back in 1930s, she did a lot of research based on antibody-antigen reaction from cell wall structure of the Streptococcus, do a serological typing, and categorize Streptococcus become group A, group B, and group D. This three is just an example. There is a many. They have like 30 maybe major Streptococcus could be categorized. Now then you're going to ask me, why Enterococcus? Seems like it's not called a Streptococcus. Why it still can be categorized? Long time ago, Enterococcus belonging to Streptococcus. Later on they separated. About like 1970 something they separate, become Enterococcus. Okay, so there's something behind that. Okay, we want to mention this bacteria. Strep Pyogenes called Streptococcus. Right, I have already group A strep. Okay, this risk group usually 5 to 15-year-old kids. Now, of course, you need to know people with pre-existing conditions, like you have a cancer, immune-compromised people, of course, those are high-risk group. Another thing you also need to know, if you have a surgical wounds, and you have cuts, or you have a chipping, hocks, blisters, these people also is a high risk group. Okay? Now we want to say something. You know strep throat. Everybody